So far, coronavirus has killed over 300,000 Americans, and unfortunately will continue to kill many more as the virus continues to spread. So now we do have several vaccines that are available, but they've just been released. Okay, just went through emergency FDA approval, and so getting the vaccine out and inoculating enough people to reach herd immunity, that 70% threshold, is going to take a lot of time. Okay, it's somewhere from 8 to 9 months even. Okay, and that's assuming, of course, most people are going to take it, because there's a lot of questions on whether or not people will actually accept taking the vaccine. So now, that said, it's going to take a lot of time to get through all of this in order to bring an end to the coronavirus pandemic. Now, that is time that members of the Trump administration did not want to spend. In fact, there's a new report from Politico where you have a former top Trump appointee who was caught in the emails urging health officials to adopt herd immunity, but this time without a vaccine. Now, I've talked about this before, okay? But this is especially damning given the language, okay? So now, here's then science advisor Paul Alexander. Now, this is somebody who, of course, worked under the Human Health and Human Services Assistant Secretary for Public Affairs, Michael Caputo. Here's what he said, quote, "There is no other way. We need to establish herd," meaning herd immunity, "and it only comes about allowing the non-high-risk groups expose themselves to the virus, period. Infants, kids, teens, young people, young adults, middle-aged with no conditions, etc. have zero to little risk." That's not true. "So we use them to develop herd. We want them infected." I mean, there it is. We want to purposely infect them. Sure, because, all the people that he mentioned are 100% segregated from people that are the at-risk populations. Oops, no, they're not. Now, he continues. It may be that it will be best if we open up and flood the zone and let the kids and young folk get infected in order to get natural immunity, natural exposure. So understand what he is pushing. Not only is it non-scientific, it's also incredibly dangerous. And here's the other thing. This ignores the evidence that we have of perfectly healthy people with no pre-existing conditions, people that you would think are normal, healthy individuals that would, do very, that would get over the virus, right? Recover from the virus that you would think, okay? These people, a lot of them have ended up getting some very serious symptoms of COVID-19, okay? Some of them that have even developed into lifelong pre-existing conditions, all right? People that are generally considered to be healthy also have died as a result of coronavirus. So, and those that haven't, by the way, they've received organ damage, neurological damage, strokes, heart attacks, etc. And while, some of the more extreme cases are rather rare, you don't know who will be infected and in what ways until people get the virus. And speaking of children, by the way, children have also died as a result of the coronavirus. So this is a monstrous plan, 100%. And by the way, they knew exactly what they were talking about. They knew what they meant, okay? But they didn't care. And the reason, of course, is politics. It's all politics. In fact, Alexander acknowledges back in a May 30th email that a draft statement from the CDC about how COVID-19 was disproportionately affecting minority populations. Now, he said in this email, yes, that is very accurate. It turns out it is disproportionately affecting minority communities. So now, instead of saying, oh, maybe we should do something about that, instead, he's like, ooh, you know what? We should change the messaging on that to make it not look so bad for Donald Trump. In fact, he warned HHS and CDC communications officials that, quote, in this election cycle, that is the kind of statement coming from CDC that the media and Democrat antagonists will use against the president. And then goes on to say, well, the real problem and the real reason that the minority, that COVID-19 was affecting minority populations the most disproportionately was, because of decades of Democrat neglect. Ah, I see. Gross. Alexander also appeared to acknowledge that the White House's own push to let states wind down COVID-19 restrictions were leading to a spike in cases, which of course makes sense, right? He said that there's a rise in cases due to testing and also simultaneously due to the relaxing of restrictions, less social distancing. Alexander wrote in a July 24th email, we always knew as you relax and open up, cases will rise. We always knew, but we pushed it anyway. We pushed it and the president pushed it. In fact, the president would go out and say, it's going to go away. It'll be fine. We're just having bigger numbers because of more testing. In fact, it's because of the testing. We're doing phenomenal testing. We're doing tremendous testing. So much testing, your head will spin. In the cases, whenever you do all the testing, it goes up and nobody can explain that because it's going to disappear and you're going to be very, very surprised when coronavirus just magically goes away. Believe me. That's what it is. That's what they were doing. That's what they were doing. And so Trump was out there bullshitting, lying his ass off. While you had people in the administration knowing exactly what was going to happen, what we were warning about, and saying, that's fine. We don't really care. We don't give a shit. I mean, what they were pushing was going to kill millions of Americans. Do the math. I know the popular thing on conservatives, like 98% recovery rate, 99.5, whatever number, because they're throwing out like different numbers constantly. Okay. Do the math though. If this is true, this is around 2 million people that are going to get affected. 2.5, 3 million people that will die as a result. If everybody in the country was exposed, we got herd immunity to 99, 100%, right? Or even 70%, you're still going to see nearly 1 million people or more die as a result of coronavirus. And so understand that that's exactly what they were pushing for. That's what they were doing. And so it's very, very sick. It's disgusting. It's a horrifying plan. Now, as a result, this went viral on social media. People are incredibly outraged as a result. Let me give you some of those responses to it. Tim Fullerton said, most experts think herd immunity with no vaccine would cost about 2.5 million lives. And here's an advisor to the president advocating for millions of Americans to die. Disgusting. And for what? Of course, Donald Trump's political aspirations. Now, just imagine, right? If, Democrats actually allowed, I think we actually did see that with Ebola, right? Except this time, the Obama administration, when that happened, H1N1, they went and fought to make sure that, as many people were protected from H1N1 as we could. Now, it didn't get to rise to the level of coronavirus, obviously, but we had at least a competent government that responded to this virus and was able to control it. 12,000 Americans were killed, unfortunately, but we're looking at right now over 300,000 Americans that have died as a result of coronavirus, where we had a situation where you could have saved hundreds of thousands of lives if you had actually done the things that you were supposed to do as a federal government. There's more. Quoting the person in the article, Dr. Beth says this, There's no other way. We need to establish herd, and it comes about allowing the non-high-risk groups to expose themselves to the virus, period. No, this is not scientifically accurate. And did anyone bother to look at any other country to see how we could address COVID-19? Oh, you mean the other countries that are actually doing a lot better? Huh. I mean, look, there's a new outbreak in Germany, right? So now you look at that, and what are they doing? They're doing targeted lockdowns. A lot better than what we're doing here. You look at Australia, specifically there's a certain state in Australia, I forget the name of it, that's actually doing very, very well. They've had no cases. You've had New Zealand that basically has no cases. And so you look at some of these other countries and what they've done, and they've been a lot more successful, whereas America, we have the highest amount of cases, highest amount of deaths. I mean, it's just, and it's because of this. As Max Tanny points out, this seemingly has been the strategy for months, but putting "we want them infected" in writing is still devastating to see. It's true. Very, very true. And again, it's all for politics and, of course, for businesses, right? So corporations can continue to make money, and the president can get reelected on his quote-unquote good economic record. That's what they want. Again, that's why they wanted more people infected. And by the way, without healthcare, we don't have universal healthcare in this country. And yet, the unofficial official policy of the Republican Party, of the Trump administration, was we want them infected. And that, by the way, explains why there was no other stimulus measures being offered by Republicans up until now, basically. Because their focus was on corporate liability and immunity for COVID lawsuits. I mean, it all goes hand in hand, right? So you pursue herd immunity, and then you prevent people who get sick from being able to sue their employer for, if they get sick because their employer didn't actually care about protecting it. It's too expensive, too onerous. Oh, wonderful. And it's especially monstrous, by the way, to think about that kind of policy, knowing people that have had the virus and knowing what it's actually like to have the virus. For one, you can't breathe. It's a respiratory virus. All right. You're drained. You can't focus. There's neurological issues. There's that brain fog that goes along with it. You can essentially barely function in a lot of cases. And that's not even counting the COVID long haulers who deal with these symptoms for months at a time and continue to have to spend all this time trying to fight it. I mean, it's horrible. So no, the people that are pushing this, they need to be held accountable. They really do. Now, thankfully, we didn't get to the crisis that they were pushing, okay? And that's as a result of some smart governors in a lot of states. I mean, you had them that pushed back, Michigan, for example, and Governor Gretchen Whitmer. Look, I was not a huge proponent of Gretchen Whitmer. I remember supporting her primary opponent, Dr. Abdul Al-Sayed. Now, Dr. Al-Sayed is in favor of Whitmer's coronavirus response, as are most smart people, okay? Because they actually did the right things to protect people. But also understand that as a result of this, of the government's actions, their official, unofficial policy, right? Of saying, let's get everybody infected. You had the state governments that were now literally also having to fight against the federal government, who through their inaction was allowing coronavirus to continue to spread. And so if that's not evil and broken, I don't know what is. And it's just more example, another example, I should say, of just the brokenness and immorality of the Republican Party. It's a disaster. All right. I'm going to take a break. We're going to come back. We have, of course, more stuff related to COVID and politics, because we're not done with that. And then I'm going to go trash Biden. So a little bit. Stay right here. Round the Nation. We'll be right back in a few minutes.
Tighten up my meat.